I have a question. I'm taking exit HES exam, but I don't know what resources to use to study for it. Need help. Um, if you go far back enough, you'll see the answer to this. I did make a video on resources. However, I made that video early in my career when I didn't realize there are politics behind this. I'm just here to teach, okay? And so I didn't know, and I was just giving you the honest answer in my opinion from what I saw. But there's so much politics behind what I do. It's ridiculous, and I try my best to stay out of it. So I don't even want those issues. I'm not going to endorse one publisher or company over another. I'm not going to do that. But like I said, if you go back far enough, you'll see my video where I did answer this question. But I'm not doing it again. But I'll tell you the things that you need to know. Make sure that you know this very well before you take your HESI exit. And this is for RN. If you guys want one for PN, I'll make one for you as well. But I did create a list, so I'll tell you what's on it. Make sure you save it. Make sure you know dosage calculations. Make sure you know your drip factor. Make sure you know your conversion rates, especially like for peds, going from kilograms to pounds, pounds to kilograms. Priority and delegation, they're going to kill you with priority and delegation. Matter of fact, priority and delegation is going to be weaved in and out of med-surg, peds, mental health, OB, you name it. No priority and delegation like the back of your hand. What else do I have on here? You're going to get lots of select all that applies. If you're doing, again, the RN exit, make sure you know shock, the different types of shock. Make sure you know ABG interpretation. You can read acid-base imbalances. You know your fluid and electrolytes, and you know what happens when certain things are high versus low, especially sodium and potassium, but not limited to. Suicide precautions, what type of patients you're going to put on suicide precautions, what you're going to ask initially if you even suspect that the patient's suicidal, substance abuse disorders, especially alcohol withdrawal. Make sure you know that. Make sure you know the signs and symptoms and the medications you expect to give. Peds, make sure you know the developmental milestones. Make sure you know the immunization schedules. Excuse me. Common childhood disorders like, tonsillitis, make sure you know those. For maternity, make sure you know your staging. Okay, make sure you know the stages of the labor and delivery, postpartum complications. Make sure you know your medications, such as your tocolytic agents, your prostaglandin analogs. What else do I have on this list? Okay, for the heart, make sure you know very well MI, CHF, hypertension, cardiac dysrhythmias, the drugs to treat them, and your nursing interventions. For respiratory, make sure you know asthma. Make sure you know the drugs to treat asthma. Make sure you know the risk factors. I told you drugs. What else? For respiratory, make sure you know your COPDs. Make sure you know emphysema. Make sure you know bronchitis. Make sure you know cystic fibrosis. For neuro, make sure you know stroke. Make sure you know your nursing interventions and in what order. So if your patient suddenly has a stroke, what you're going to do first, second, third, fourth, and what you're going to do last. I'll tell you right now, documentation is going to be last, okay? You take care of your patient, you do everything you got to do, you make your phone call to the healthcare provider, documentation last. So make sure you know that. Spinal cord injuries, make sure you know about that, how you're going to position the patient. Make sure you know meningitis. Make sure you know the signs and symptoms of meningitis if the patient comes in and you even suspect meningitis. What's the first thing you're going to do versus second, third? For GI, make sure you know the difference between peptic. What is it? No. Oh my gosh. I'm having a brain fart. The syndrome versus the disorder. Why can I remember? The disorder, which is Crohn's and UC, ulcerative colitis. I'm having a brain fart, guys. But the disorder is the worst. Syndrome is more mild. Make sure you know the difference between the two. Oh my gosh, I can't think. GI, oh, appendicitis. Make sure you know the signs and symptoms of appendicitis. Make sure you know the signs and symptoms of rupture. That's a medical emergency. Okay, that patient's going to be in PO. Make sure you know cholecystitis, the gallbladder, what kind of food the patient needs to avoid or stay away from. Renal, make sure you know the difference between acute kidney injury versus kidney disease. Dialysis, what you're going to do for your patient, what fluid electrolytes you're going to be monitoring the most. Potassium. What else do I have on that list? Endocrine, make sure you know diabetes type 1 versus type 2. Make sure you know the clinical manifestations. Make sure you know your insulins. And when I say your insulins, it's not enough to know, the onset, the peak, the duration. You have to actually know when to apply it. So for example, if they ask you when you're going to feed the patient, what they're really asking you is the onset of that particular insulin versus if they ask you when you expect to give the next dose. That means they're asking you what? The frequency of that not the frequency, the duration of that medication versus if they ask you, when you're going to be most concerned or when you're going to reassess your patient, what they're really asking you is a peak time of that insulin. So make sure you know those well. Thyroid disorders, make sure you know hyperthyroidism versus hypothyroidism, where you're going to place the patient, what your nursing interventions are going to be. Okay, I did endocrine. No, I'm not done. I didn't write this down, but I know you definitely need to know this. Also endocrine, your Addison versus Cushing's. You need to know DI, diabetes insipidus, versus, what's the opposite of DI? SIADH. Okay, and so for those two, you need to know when the urine output is up, when the urine output is down, when the urine specific gravity is up, when the urine specific gravity is down, when you're going to give your patient fluids, when you're going to withhold fluids, the nursing interventions, you got to know that. Tuberculosis, HIV. Oh, you got to know what patients are immunocompromised. You need to know those HIV patients, the patients who have cancer, but they're getting chemo radiation. You need to know the patients with autoimmune disorders. Don't say I didn't warn you. All right, what else on my list? Drugs, so many drugs. You got to know your antihypertensive agents. Not only do you have to know the antihypertensive agents, you got to know the differences in the class. So you have to know the differences in your beta blockers versus your calcium channel blockers versus your ACE inhibitors, your ARBs. Don't shoot the messenger, guys. I'm just trying to help you. So you got to know those. What else do I have on drugs? Drugs with narrow therapeutic range. You got to know your lithium, your digoxin, your theophylline. You got to know the kind of foods that the patient has to stay away from, or the labs that you're going to be monitoring on those drugs that have very narrow therapeutic range that I just mentioned. Is that a smoke alarm? Okay. PPE, you have to know the order of putting on the PPE, taking that off. Vital signs, of course, you got to know your vital signs, but it's not enough just to know the vital signs. You got to know what it means. So you got to know if the heart rate is out of range, the blood pressure is out of range, but also what it means. So if you see the blood pressure is going down, but heart rate's going up. Also, when you look at the labs, RBC going down, H&H going down, what's most likely happening? The patient's bleeding out. What's your nursing intervention going to be? So not only do you have to know the lab values and the vital signs, you have to know what it means and those nursing interventions for them. Priority and delegation, I told you that already. HIPAA, I'm running out of time. But, therapeutic communication. Guys, you have to know the difference in, what's that word when you're trying to protect yourself? In psych. Like projection and denial and all of those. I can't think because I'm not good at trying to think very quickly, but you got to know those. That's just a few. I'm sure I'm going to do a part 2. I hope this was helpful.